Demystifying Medicare, the Summer Academy, is a full-day seminar where students, interns, and young professionals come to learn the nuts and bolts of Medicare. The point of the program is really to demystify some of the misinformation that is out there.
That I started with the requirements.
Medicare is important to me mostly as a student of economics, because I believe that it's essential for our society to care for people who may not be as able. And if we provide them with some care, they can make a social contribution that is valuable to the country.
The Medicare Summer Academy is a chance for NASI to bring experts and interns together. So folks that are just coming to Washington for the first time can really learn about Medicare and its importance.
We have an online tool called Medicare Interactive, which is essentially a Medicare dictionary.
Medicare is relevant to young people today, and that is what this event is about. Bringing together young people to think about the issues and reforms that are on the table and firing up future policymakers for that discussion.
If you poll most Americans, Social Security and Medicare are the two most popular programs that we offer to people in the United States. This is a promise from one generation to another.
If you can cover that, I think everything else would kind of take care of itself.
So often when we learn about Medicare for the first time, we may have an opinion of the program before we even know who relies on Medicare benefits most heavily. Why are there so many different parts to the program, and how is each one financed? What do we really mean when we say Medicare is running out of money?
The MedChat exercise looks at various different areas of the Medicare program. Everything from long-term care, to emergency room care, to transportation to the hospital, to how much premium someone is going to pay. And then it decides what kind of Medicare program do we want? Where do we want to spend those precious resources?
So I guess how are you guys differentiating between long-term and the final phase?
Two sisters were debating where to keep the mother on their life support because one was...
Why does Medicare matter to people under the age of 25, under the age of 35? It's an intergenerational question for me, and that's a lot of the reason that I study these issues. But I care about these issues. Medicare is one of them.
This wasn't easy, but you knew that everyone has to play a part in making this country a better place.
It's really important that the National Academy of Social Insurance is conducting programs like this. They inform students who will go out and build their careers and will be engaged in health activity, health access. So those are really, really important things for building the stronger Medicare program into the future, having a more informed group of advocates and researchers and the likes.
One of the best things about the event is just how fun it is. People come here to learn, they come here to network, to meet peers who are passionate about the same issues that they're interested in. They come here to participate in this interactive and exciting seminar.